Can you have sex in case of genital herpes? Although it is sexually transmitted, this infection due to a virus does not imply that you have to give up your sexuality. Painful blisters, scabs. Symptoms of genital herpes can be painful but also very visible, so much so that many people concerned do not dare to talk about it, preferring to put their sex life on hold. However, having genital herpes does not mean that you can no longer have sexual intercourse, assures Carol-Ann Morier, manager of the Infos Herpes project, whose objective is to inform and support people living with herpes virus. However, some reflexes are necessary to avoid transmitting this virus to his or her partner, because once contaminated, it is impossible to get rid of it. What to do to avoid contaminating her partner? Herpes develops in outbreak. If the virus is most often discreet, it wakes up in phase. In the event of a crisis, it is better to abstain from all sexual relation. Indeed, the vesicles, small buttons filled with a translucent liquid, are virus reservoir. A simple contact with an infected person is enough to be contaminate. This precaution is valid from the first signs of the outbreak, such as a burning sensation or itching, underlines D. Isabel Gallet, dermatologist and vice president of the National Syndicate of Dermatologists and Venerologists, SNDV. And the rest of the time? We must not lower our guard because, even in the absence of symptoms, the virus is still there. It can even be present in the genital mucous membranes without causing visible lesion. The risk of transmission exists, even if it remains less important than in the event of a crisis. The condom remains the first defense against this sexually transmitted infection, STI, and against all the others, recalls Drive David Botolo, virologist and head of the National Herpesvirus Reference Center at the Pitié-Salpêtrière Hospital, APHP, Paris. As long as it covers the infected areas, the condom prevents the transmission of the virus. But this protection is not infallible since the virus is not confined to say. You have to identify the area affected by the virus, or the area where the vesicles are during the outbreak, and avoid any contact between it and the partner, warns Carol-Ann Morier. And if both partners are carriers of the virus, there is obviously no risk for herpes. But that doesn't mean you have to stop protecting yourself, because there are many other STIs out there. How to protect yourself. Another important point. The virus can be transmitted without there being penetration, for example in the event of oral sex or with the fingers, specifies D. Gala. A person with labial herpes, the famous cold sores, can also be the cause of a genital infectio. Nearly half of cases of genital herpes are caused by the virus that causes cold sores, HSV1, explains D. Botolo. The reason is simple. During orogenital intercourse, cunnilingus, fellatio, rimming, the HSV1 virus present in the lips can be transmitted to the partner in the genital. Alternative to abstinence. It is possible to use a dental dam, a kind of condom to put in the mouth in the event of oral genital intercourse in order to avoid possible contaminatio. Despite these precautions, it is possible to be infected or transmit the virus without even knowing that you are a carrier. In this case, it should be borne in mind that despite the discomfort of the symptoms, this virus is only very rarely dangerous, and the infection is not linked to a lack of hygiene. During pregnancy, be extra careful. Only case where genital herpes can be dangerous, if it is transmitted to the baby during childbirth. D. Botolo explains that, if the mother has an outbreak of herpes at the time of delivery and it is her first infection with the virus, the risk of transmission of the virus to the newborn is order of 40% to 50%. A rare but serious infection, the risk of mortality and severe sequelae is very high. It is therefore essential to prevent the mother from being infected for the first time with the herpes virus during her pregnancy. And if a woman has a herpes outbreak within 6 weeks of her due date, a caesarean delivery is recommended.